Why is my home blood pressure monitor inaccurate after stroke? Have you ever wondered why your home blood pressure monitor gives you readings that seem off, especially after experiencing a stroke? This can be frustrating and concerning, but understanding the reasons behind these inaccuracies can help you manage your health better. Let's dive into some common factors that can affect the accuracy of your home blood pressure monitor after a stroke. First, incorrect use of the monitor is a significant issue. Many stroke survivors may not use their devices correctly. For accurate readings, it is essential to sit quietly for at least 1 minute before taking a measurement. Using an upper arm cuff is crucial, as wrist or finger monitors can be less reliable. Additionally, taking multiple readings and following the device instructions carefully can make a big difference. Research indicates that only about 20% of patients after a stroke use their home blood pressure monitors correctly. Next, consider the quality and validation of the device itself. Not all home blood pressure monitors are tested for accuracy. Many popular models on the market have not undergone rigorous validation. For stroke survivors who need precise blood pressure management to reduce the risk of another stroke, using a low-quality or unvalidated device can lead to misleading readings. Physiological changes after a stroke can also play a role. A stroke can cause alterations in vascular tone and arterial stiffness, which may affect how blood pressure is measured. These changes can lead to variability in readings, especially with cuff-based devices. Additionally, if one arm is weaker or has swelling, this can impact cuff placement and measurement accuracy. When measuring blood pressure, arm selection and positioning are critical. If one arm is affected by weakness or impaired circulation, using that arm can yield inconsistent results. The American Heart Association recommends using the upper arm cuff on the non-affected arm whenever possible, and ensuring that the arm is supported at heart level during measurement. Another factor to consider is the lack of regular calibration or validation of the device. Home monitors can drift in accuracy over time. It is advisable for stroke survivors to bring their monitors to their healthcare provider annually or as recommended. This allows for comparison with professional equipment and recalibration if necessary. Lastly, user response and follow-up are essential. Even when abnormal readings are detected, many stroke survivors may not have a clear plan for consulting their healthcare provider. This can lead to mismanagement of blood pressure and contribute to the perception of inaccuracy if readings are dismissed. In summary, inaccuracies in home blood pressure monitoring after a stroke often stem from improper technique, the use of unvalidated devices, physiological changes, and failure to regularly check device accuracy. Stroke survivors should strive to use validated upper arm cuff monitors, follow proper measurement protocols, use the non-affected arm if possible, and maintain regular consultations with healthcare professionals. This approach is critical for effective blood pressure management and preventing stroke recurrence.